It is the medicine that is keeping them alive, but it is the price that is causing them a lot of pain.
Investigative reporter Brian New on the rapid rise of life-saving medicines and the people who can't live without them.
Filling a prescription can be expensive, sometimes real expensive.
This bottle of drugs here cost about $16,000 a month.
But for many, the real sticker shock,
well, I about fell off my chair,
is how much the price has gone up.
There's no way that we could possibly afford it.
The I-Team found more than a dozen prescription drugs have nearly doubled in price in the past 5 years. Some, like this asthma drug and this antidepressant, have increased by almost 3,000%. It's these types of price hikes that has this mother.
I don't know what we're going to do.
This grandmother.
I worry, yes.
And people like Veronica Crow, all worried that the medicines they need are quickly becoming too expensive to afford.
It's definitely a lot of money.
Crow has been on 6 different medications for her epilepsy, but her seizures finally went away when her doctor prescribed Vimpat.
I would hate to see where I would be right now because the others didn't work.
Without this pill, Crow says she would have never made it through graduate school and never had the confidence or freedom to travel. But that freedom is far from free.
My medication is about $5,000 for 90 days.
That's $2,000 more than what it cost just 5 years ago. Using this national drug database, the I-Team found other epilepsy drugs have gone up even more. The cost of all 6 of these drugs jumped by more than 90% in the past 5 years. Zonegram went up by 213%, Ativan by a whopping 569%.
Definitely something that I worry about every day.
And she's not the only one.
This is the $14,000 a month.
Violet Southall receives financial help from a foundation to pay for her cancer drug. Without it, there'd be no way she could afford it.
There's no way on earth. Even if we sold the house.
And without her medication?
Oh, Brian, I wouldn't probably be sitting here if I didn't have this medication.
Southall's cancer drug, Afinitor, has gone up by nearly $5,000 a month. And every time the price goes up, Southall worries the number of places where patients can go for help will go down.
The foundations run out of money very quickly.
Critics argue charitable foundations, often largely funded by drug makers, simply mask the problem.
We got all these great new drugs, but gosh dang, they're expensive.
Dr. Ray Page is the director of research at the Center of Cancer and Blood Disorders. He says the emotional stress on a patient of not knowing whether they can pay for their medication can lead to risky and even deadly decisions.
Well, we have patients that oftentimes run into delays on getting life-saving therapies, and then there's some people that make decisions to just forego treatment altogether.
We reached out to the 10 largest drug makers in the United States, and they told us they've tried to lower prices by giving insurance companies rebates. But they say insurance companies don't always pass along those discounts to the patients. Drug makers also argue research and development of new drugs is expensive. But that doesn't explain this.
This is my Novolog pen.
16-year-old Morgan Harris has type 1 diabetes. So whether she's at cheer practice or raising rabbits, her insulin goes wherever she goes.
Everywhere I have to, because I never know when I'm going to eat something or need to check my sugar.
Insulin is not new or cutting edge. The FDA approved its use 35 years ago. But the I-Team found the big 3 insulin makers all nearly doubled their price since 2012. Harris's 2 insulins now cost $1,000 a month. And even with insurance, her family is still on the hook for the full price until they reach their $6,000 deductible.
If we made a whole lot of money, it wouldn't matter. But we're middle-class people, so it's hard to afford this stuff.
The I-Team also found price hikes with these generic drugs, many developed decades ago. Some have doubled in price, some have tripled, and others have gone up even more.
What do you do? I'm at a loss.
Harris's mother says, like any parent, she would do anything to keep her daughter healthy. And she believes some drug companies take advantage of that.
That's where they get you. They know that parents are going to do whatever it takes to get medicine for their kids, for their children to survive. They know that. So they're going to mark it up and make whatever they can off of it.
Now, we've heard from a lot of you already. I want to continue this conversation on what can be done. So on our website, we have compiled a list of more than 30 popular drugs showing what the average retail price is today and what it cost 5 years ago. And on a lot of these, you'll see a dramatic increase in just 5 years.
I think based on the three different segments of people we just saw, there's a lot of empathy because a lot of people have been in that very same boat. Yeah. So answer the question, though, when it comes to these dramatic price swings, when we think about the EpiPen that you mentioned, things like that, is there not something the federal government can do at all?
The simple answer is no, not unless there's some laws that change. There is a push right now in Washington that would allow the federal government to negotiate prices directly with drug companies. Now, many believe that that would lower prices for all of us, but they would have to change a law to do this.
Legislation.
So, not simple.
It's a good insight, and it's something I think a lot of people can identify with.
And maybe just having this conversation will at least maybe trigger the possibility of this happen down the road. Something needs
for sure.
to
And
change.
honestly, Brian's got a lot on our CBS DFW Facebook page. If you want to jump in the conversation, share your story. There could be more to come on this.
Yeah, absolutely.
Brian New, thank you, buddy.
Thanks.
Appreciate it.
Good stuff.